My name is Vincent Kamara. I work as the data manager at the National TB and Leprosy Control Division, Ministry of Health, Uganda. To me, DHIS2 is a platform that bridges data demand and information use. From my data perspective, I have gone through a lot of questions of which data, when and why, but with DHIS2 I'm able to answer all these questions more quickly, both from the program side, the data side that provides the data, and the users of the data out there. So to me, it's a platform that has eased all those fronts to answer the questions that need to be answered. In our program, we have utilized DHIS2, both the aggregate and the tracker. So specifically for TB, DRTB, we have moved from aggregate slowly to introduce the tracker-based tracking of TB, drug-resistant TB patients, which helps us to give us, in this era of line lists, we are able to account for the people who have DRTB, who they are, where they're from, and do much more. We can do geographical spatial analysis. We can know who they are, where they come from. We can know the hotspots. And this has really been due to the tracker-based DHIS2. It was a magic bullet. I have an example of one where we were testing. We did a community campaign where we identified TB patients, but we identified more DRTB patients in a certain region. Because of our DRTB tracker system, the electronic case-based surveillance system, we were able to map out some hotspots. And when we went to these hotspots, we actually did a bit of contact tracing using the same system, and we were able to identify more DRTB patients. So it was a big success. The other was when we did, we were testing out stool testing for TB. So there was a case where they reported some children in a school who had TB, who were suspected to have TB. So when we went out, we did tests, and then we were able to identify more children, and we used the new SOS, the stool testing for TB, to identify more TB patients who could not produce sputum, especially the children, and we were able to identify more and more. And to me, this has been much better when we are using our TB surveillance system. The whole world needs this, and DHIS2 to the world, and I think we can do much more better in data demand and information use for planning, budgeting, and others. Yeah.